If you are over the age of 60, there is a silent shift happening inside your body that your standard medical checkups are completely missing. You might think you know what a urinary tract infection feels like because you have dealt with them before, or you've seen your spouse go through it. You expect the burning, the frequent trips to the bathroom, and the sudden urgency. But after 60, the classic warning signs often vanish entirely. Instead, a urinary tract infection can masquerade as sudden confusion, extreme fatigue, a loss of balance that leads to a nasty fall on the golf course, or even a frightening change in your personality that makes your family wonder if you are developing dementia. This is the hidden crisis of senior health, and ignoring this single, unconventional symptom is sending thousands of independent, active retirees to the emergency room every single week. I am Dr. Carl. I have spent 16 years practicing as a urologist, helping thousands of men and women navigate the changing realities of their bodies as they get older. Today, we are going to walk through the 8 hidden, non-traditional urinary tract symptoms and habits that you absolutely cannot afford to ignore after 60, including the unexpected ways your daily routine might be secretly inviting dangerous bacteria into your system. Make sure you stay with me until we get to number 5, because this specific, overlooked physical sign is the one most frequently misdiagnosed as standard aging, and catching it early can quite literally save you from a weeks-long hospital stay. Before we dive into the first sign, I want to ask you a quick question, and I want you to drop your answer in the comments below. How many times are you currently getting up in the middle of the night to use the restroom, and has that number changed in the last year? Go ahead and type it out because I personally read every single comment, and your real-world experiences directly shape what medical topics I cover in these videos next. Let us start with the single most alarming symptom that almost nobody connects to their bladder, and that is sudden mental confusion or a rapid shift in your mood. In my practice, I cannot tell you how many times a frantic adult child has brought their 65 or 75-year-old parent into the clinic, convinced they are witnessing the sudden onset of Alzheimer's disease or a mini stroke. The patient is suddenly disoriented, forgets where they parked their car at the grocery store, or becomes uncharacteristically irritable and anxious during a family dinner. What is actually happening inside the body is a process called systemic inflammation. When you are younger, your immune system mounts a highly localized attack against bacteria in the bladder, which causes that localized, sharp pain we all associate with infections. But as we get older, our immune response changes. The bladder lining becomes less sensitive, so the local warning bells do not ring. Instead, the infection quietly multiplies, and the resulting inflammatory chemicals cross the blood-brain barrier. Think of it like a power surge in your home's electrical grid. The problem started in the basement breaker box, which is your bladder, but the lights are flickering upstairs in the living room, which is your brain. According to clinical reviews published by the American Geriatric Society, acute delirium is one of the most common presenting signs of a urinary tract infection in older adults. If you or a loved one experiences a sudden, dramatic change in mental clarity over the course of just 24 or 48 hours, you should not assume it is dementia. Your very first step this week should be to call your doctor's office and request a simple, painless urinalysis. It is a quick test that can clear up the confusion before things escalate, but always remember to consult your physician before making any sudden changes to your routine. The second hidden sign you need to watch for is a sudden, unexplained loss of balance or a general feeling of weakness in your legs. You might find yourself reaching for the furniture as you walk through the living room, or perhaps you feel unusually unsteady when you step out of bed in the morning to head to the kitchen. Many seniors chalk this up to arthritis, a bad knee, or just a natural consequence of getting older and losing muscle tone. But a hidden bladder infection can severely disrupt your proprioception, which is your body's innate ability to sense its position and balance. Imagine trying to drive your luxury sedan when the alignment is completely out of whack. You have to fight the steering wheel just to stay in your lane. When an infection is brewing, the subtle, constant toxic load weakens your large muscle groups, particularly in your legs and core, making you highly susceptible to slips and falls. Research from the American Urological Association has shown a significant correlation between undiagnosed urinary tract issues and an increased risk of falls among independent seniors. If you notice that your stability has suddenly taken a dip this week, do not just try to push through it or wait for your annual physical. Take a close look at your recent physical activity, note any new unsteadiness, and bring a small log of these episodes to your healthcare provider to check for an underlying low-grade infection. Moving on to our third sign, we have to talk about a subtle but persistent change in the way your urine actually smells. Now, I know this is not a pleasant topic for Sunday brunch, but paying attention to what is happening in the commode is vital for your health. Many people think that unless their urine is dark brown or bright red with blood, everything is fine. But if you notice a pungent, musty, or intensely sweet odor that lingers, your body is trying to tell you something. When bacteria take up residence in your urinary tract, they break down urea, which is a natural waste product in your body, and convert it into ammonia. It is the exact chemical process that happens in a neglected stable. If your urine smells strongly of ammonia first thing in the morning, or if it looks unusually cloudy like a glass of unfiltered apple cider, that is a clear indicator of bacterial overgrowth. A study published in the Journal of Urology highlights that while cloudy or foul-smelling urine alone does not always mean you need heavy antibiotics, it is one of the primary indicators that your bladder microbiome is out of balance. Your action step for this week is simple. Increase your pure water intake by just one full glass in the morning and one in the afternoon, and see if the odor clears up within 48 hours. If the smell persists despite good hydration, it is time to have a conversation with your doctor. Our fourth major warning sign is a sudden, profound fatigue that leaves you feeling completely drained by noon, even if you slept soundly through the night. You might find that you no longer have the energy to play your usual 9 holes of golf, or you are turning down invitations to go out to dinner with friends because you just feel utterly wiped out. It is very easy to blame this on a busy week with the grandkids or a change in the weather. But fighting an infection requires a massive amount of metabolic energy. Your body is redirecting all its resources, turning down the power to your muscles and your brain to fuel the immune cells fighting the battle in your bladder. It is like running the air conditioning, the pool pump, and every major appliance in your house all at once. Eventually, the main breaker is going to trip to save the system. Mayo Clinic reviews frequently note that generalized, unexplained lethargy is a primary-secondary symptom of infections in older populations. If you find yourself needing an afternoon nap when you never used to, or if your morning walks feel twice as hard as they did last week, do not ignore it. Track your energy levels for 3 days, and if the fatigue does not lift, call your clinic for a quick screening. Let us take a very quick pause right here. If what we are discussing is helping you connect the dots about your own health, or perhaps explaining a strange symptom a spouse has been dealing with, please take a brief second to tap that like button down below. It takes just a moment, but it tells the system to share this medical information with more seniors who truly need to see it. And while you are down there, tell me in the comments, have you ever experienced a symptom that your doctor completely misdiagnosed at first? I want to hear your stories because they help our entire community learn. Now, let us get straight back into it with number 5, which is the specific sign I warned you not to miss: the complete absence of a fever despite a raging infection. When a young adult gets a kidney or bladder infection, their body immediately cranks up the thermostat, running a high fever to bake the bacteria out. But after 60, and especially as we get into our 70s and 80s, our body's baseline temperature regulation changes. The hypothalamus, which acts as the thermostat in your brain, becomes less responsive. This means you can have a severe, spreading urinary tract infection with an entirely normal temperature, or your temperature might even drop slightly, leaving you feeling chilled, shivery, or clammy. This is precisely why so many seniors end up with advanced infections. They tell themselves, well, I don't have a fever, so I must not be sick. Medical literature from the National Institutes of Health emphasizes that the absence of a fever in older patients frequently delays diagnosis, allowing simple bladder infections to progress into dangerous bloodstream infections known as urosepsis. Your action step this week is to establish your true baseline. Buy a reliable digital thermometer from your local pharmacy counter and take your temperature at the same time for 3 days in a row when you feel perfectly healthy. If you later feel unwell, dizzy, or just off, and your temperature is even 1 or 2 degrees higher or lower than your personal baseline, that is your cue to seek medical advice. The sixth sign is a subtle, deep ache in your lower back, your flanks, or your pelvic region that you might easily mistake for standard lumbar stiffness or sciatica. Many active retirees spend a lot of time on their feet, whether they are gardening, playing tennis, or walking the neighborhood. When your back starts to ache, it is incredibly easy to assume you just overdid it on the course or need a firmer mattress. However, when bacteria migrate up from the bladder into the ureters and kidneys, it causes the capsules surrounding the kidneys to stretch and swell. This triggers a deep, dull, visceral pain that radiates across your lower back or right above your hip bones. Unlike a pulled muscle, this specific ache will not change when you adjust your posture. It will not feel better if you lie down, and heating pads will offer little to no relief. Many doctors are seeing patients who spend weeks in physical therapy for back pain when the real culprit was a slow-burning kidney issue all along. If you have a backache that is persistent, independent of your movement, and accompanied by a slight loss of appetite, make this the week you get a professional medical evaluation to rule out renal involvement. To avoid the hassle of finding a public restroom, they stop drinking water a few hours before leaving the house. While this might seem like a practical solution for convenience, it is one of the most dangerous things you can do to your urinary system after 60. Your bladder needs a constant, steady stream of fluid to flush out the bacteria that naturally try to crawl up the urethra. When you restrict fluids, your urine becomes highly concentrated and acidic, which irritates the bladder wall and creates a stagnant, warm pool where bacteria can multiply rapidly. Think of your bladder like a mountain stream. As long as the water is rushing and moving, it stays crystal clear. But the moment the flow stops, it turns into a stagnant, muddy pond. Some studies suggest that even mild chronic dehydration increases your risk of chronic bladder irritation by over 50%. This week, try a different strategy. Commit to drinking small, consistent sips of water throughout the day rather than gulping large amounts at once. This keeps your system flushed without overwhelming your bladder all at once, and it is a crucial conversation to have with your doctor if you are managing heart or kidney conditions that require strict fluid limits. Finally, number 8 is the subtle interference of common over-the-counter medications that many older adults take daily for sleep, allergies, or minor aches. When the bladder muscle becomes too relaxed, it cannot contract fully when you go to the bathroom. This leads to a condition called urinary retention, meaning a significant amount of urine remains trapped inside your bladder after you think you have finished. That leftover urine is a goldmine for bacterial growth. If you notice that your stream feels weaker, or that you have to push or strain to empty your bladder since starting a new over-the-counter remedy, that is a major red flag. His story is a classic example of how a urinary tract issue looks completely different after 60. To make sure you can protect yourself starting tonight, here is tonight's plan with 3 simple, concrete steps you can take immediately. First, purchase a simple digital thermometer and log your baseline temperature for the next 3 mornings. Second, commit to adding 1 extra 8-ounce glass of water to your morning routine right after you wake up to flush your system early. Take a look at your nightstand and check the labels of any over-the-counter sleep or allergy medications for anticholinergic ingredients. Fourth, if you experience any sudden back pain or mental fog this week, do not wait. Call your doctor's office immediately and request a quick urine screen. And fifth, never intentionally hold your urine or restrict fluids before a road trip or an outing. Instead, plan regular bathroom breaks every 2 hours. While managing your hydration is a vital step for your bladder, there is another common morning beverage that millions of seniors drink every single day that might be silently eroding your kidney function and skyrocketing your blood pressure without you ever feeling a thing. In our next video, we are going to expose the one popular breakfast drink that many doctors are quietly telling their patients over 60 to ban from their pantries immediately. I am Dr. Carl. Stay well, and I will see you there.